Hello, everyone, and welcome into Senior Living Live. My name is Melissa. Thanks so much for being with us. In today's episode, we're discussing some of the most common health issues for seniors and symptoms you might want to keep an eye on to help prevent some of these issues for you or your loved one in the future. Suzanne Price with the Arbor Company joins me here today to help us break down some of these more common issues. Suzanne, great to see you. Our list certainly isn't a total list, which would be several pages long of all the issues you could face in your senior years, but we are sticking to the most common issues that seniors do face today. And we are so fortunate that you could be with us to discuss. Thanks for being here.
Oh, thank you. My pleasure.
Well, first and foremost, let's talk about you. Tell us about yourself and what you do for the Arbor Company.
So I'm a registered nurse. I started out at the Arbor Company as what we call a resident care director, which is something akin to a director of nursing in one of our communities. And I did that for a few years. And then I started actually visiting other communities as a clinical specialist. And that is what I currently do. I travel to all of our communities and visit and help and train and support and enjoy all of the seniors all across our communities.
Got it. Yeah. And it's clear that you enjoy and you love what you do. And those are the type of people that we have working for the Arbor Company, just like yourself, which makes it a great place to be if you're looking for senior living for sure. So as we mentioned, this isn't an entire full list of all the things that somebody could face, as they get older, as we age. But I'd like to maybe slim it down to something that could be easy to remember for our viewers. And so we're going to talk about the 3 B's, bones, belly, and brain. So let's start with issues of the brain first.
All right. So one thing I think is really important to consider as we talk about all of these different issues is that they are very much interrelated. If we've got something going on in one area, there's a good chance it's correlated to something else. So keep that in mind as we're talking, and I will point that out. But let's start with cognitive impairment. It is normal to have a little bit of forgetfulness as we age. Perhaps we're not able to do things quite as quickly. We just need to slow down. We might need an extra minute or two to remember a name or a location, but we can do our daily activities such as dressing, visiting with others. We recognize other people. We may not remember their name. That's okay. I never remember names, but you know who they are. So I just want to make that there is a difference between normal aging and some cognitive impairment that might be occurring. So we're going to talk about the cognitive impairment for a minute. I do want to point something out. As we were saying, there are interrelated issues here. Hearing loss can be related to dementia. And it's really important. Something that I see a lot with our senior folks is they may have some hearing deficit, but they don't want to wear those hearing aids. It's just, they're fussy, it's a challenge, they fall out. I would really encourage everyone to make sure that they're mindful of that, because there is a really big increase in the significance of dementia correlated with hearing loss. So if you're noticing some hearing deficit, do go in and have it checked. And if you have hearing aids, wear them. It takes about 6 months to really get comfortable with hearing aids. So don't give up, push through it, because that will help you to maintain that cognition and to make the most of what you have. So as far as cognitive impairment, it's pretty prevalent as we age. About 1/3 of folks, well, let me back up. About 1/3 of folks with hearing impairment are in the age bracket of 65 to 74. It goes up to 1/2 over the age of 75. So that's a pretty big number there. But here's the big number. The incidence of dementia was 61% higher with those that had a hearing impairment than those with good hearing. We just don't talk about this a lot. And frankly, until I got into this field of nursing, I did not realize that. So I want to make sure we're getting those kind of testings done on a regular basis, and then wearing those hearing aids once we get them. So as far as dementia itself goes, we have the major type that I think we're all aware of, and that's Alzheimer's, but there's also other types of dementia. And again, those are correlated to other disease processes or diagnosis that we may have, such as diabetes, heart conditions, if we have been smoking, vascular incidents of dementia, those are all correlated. If we are looking at Alzheimer's itself, it has more of a reliable pattern of progression. And if you see, or you have a loved one, or you're experiencing yourself moments of perhaps you're driving somewhere that you've always driven and you all of a sudden are lost and you cannot figure out where you are. You're doing something you've done forever, and it's just not a momentary, now where was I in this process? Or why did I walk into this room? It is more of a complete, I have no idea how to finish this task. It might be some language loss. I think everyone is familiar with Bruce Willis and his, they called it aphasia. That is a form of dementia. So if you really are having a hard time finding word usage that you've always been able to quickly come up with, that's a red flag. So numbers, the ability to recognize people that, as I said, are really important pinnacle people in your life that you see on a constant, those things are things to be mindful of. As far as what to do if you feel like there might be an issue there, or you have a loved one that you're concerned about, make an appointment with, if you want to go with your family doctor first, that's certainly a great place to start. And then they should probably refer you to a neurologist. If you are just concerned for your own self, I am not slowly, quickly getting to that age of myself. So there's some things I'm mindful of. You want to keep your brain active. One of the things that they noticed in the hearing research that they did was those folks, because they cannot hear, they were isolated, which we know has a correlation with our cognitive retainment and sometimes our dementia progression. So being isolated, being by yourself, those are things that will not help, but really hinder your ability to maintain cognitive status. Socialize, being around people, trying different things that you haven't tried, eating good, healthy foods, exercise, getting enough sleep. Those all do have an effect on not only cognition, but all other areas of our life. And you'll hear me saying that a lot because it's almost, they're too simple, but those are the first things that we need to look at before we look at medications and more advanced. If you have sleep deprivation and you've got a lot of issues with waking up in the night, getting REM sleep, that alone might be the reason that you're having some cognitive decline.
This was a fantastic list. I mean, even things I've been doing, senior living life for a while now, and we have a lot of discussions about dementia. And I'm so glad that you mentioned that correlation with hearing loss, because it doesn't get mentioned that often. And a lot of people overlook that. So I am so glad that you mentioned that, because hearing loss is, as you mentioned, it's common, and the fact that it leads to the isolation you discussed, which I think more people are starting to understand with our older loved ones based on what happened with COVID.
Absolutely.
I think that I'm just so glad that you mentioned that, so that somebody today can sort of get that aha moment and put those two and two together and then go seek help either for themselves or for a loved one. So fantastic list there. So now we go to the next B, and that's our bellies. So
our bellies, yes, our fussy little bellies.
That's right. So what are some common problems that we're going to be looking for there?
Well, we're just going to say it out loud and put it on the table. Constipation, urine incontinency, or just not getting there in time. You know, you sneeze and all of a sudden you're in that, uh-oh, you know, here I am. And I will say, again, incontinence is something that we all kind of laugh about, go, oh, yes, it's part of getting older. First of all, it is a huge quality of life effector. It really can affect someone's ability or desire to socialize, to extend themselves out of their home, because they are fearful that they will not make it back in time, or that they will have something embarrassing happen while they're out and about. So, you know, that needs to be respected as a huge health issue, and the support that is needed. First of all, I would say go to your doctor. Always, first thing, go to your doctor, and don't just say, oh, this is what it is. There are different things that might be going on. You could have a chronic urinary tract infection. As we get older, the symptoms that we had when we were younger, where we knew within moments almost that we had a UTI, are no longer there. So our seniors can be having a chronic situation for quite some time and not realize that they actually have a urinary tract infection, both men and women. You know, we have prostate issues coming into play with men. We have women who their pelvic floor is weakening, and so they just cannot retain, they don't have that muscle strength anymore. You can work with continence programs with therapy that will actually work on, I think we've all heard of Kegels, that exercise that will really strengthen that pelvic floor. Again, those are things to look at in addition to whatever your doctor recommends that you can do, and do your own work and make as much impact as you can on your wellness. I would say another thing to be mindful of is just not to drink liquids past about 5 o'clock at night, maybe a bit earlier. I say that though with a balance, because another thing we see with seniors a lot is they restrict their fluids because they don't want to have a situation, and that's not good either. So there is a balance. Just start drinking early in the morning, drink a lot of fluids, take it in, and then just have that cut off so you're not up all night. And talk to your doctor about any issues, changing a medication. If you have what is commonly called a water pill, ask them, if it's not in the morning, ask them to put it in the morning instead of at night, or just in a place that you can work with it and still feel like you have your quality of life.
Yeah, and that's what this is all about, really. It's quality
It
of
is.
life. We're living longer and longer and longer, and we want to be as healthy as we can as we get into
Absolutely.
our 70s and 80s. You know, we want everything to work and to work as well as it can,
Absolutely.
right?
Yes.
So it's
Yes.
truly all about quality of life. Okay, so now speaking of quality of life, and this is a biggie, we're talking about our bones. So what can we
Yes.
do to help ourselves on that end?
And you're right, it is a biggie. It is especially prevalent with women to have osteoporosis, which is just a thinning of the bones. And it is a huge issue because as we age, we tend to have more loss of balance or stability issues, just weakened muscles again. And so you see folks that may have falls that was not a problem before. If you have osteoporosis and you fall, the incidence of fractures and injuries is much higher because your bones are weaker. We even see folks who are just kind of living their life and maybe take a misstep. It's not even really a fall, but because of osteoporosis, they have a fracture. So because there are no symptoms to osteoporosis, we tend to do that after the fall, after the fracture is when we say, oh, wow, this person has osteoporosis. We need to go in early, and especially if you have that profile. You and I both are that profile of a smaller female, and go in and get checked early, have a bone scan, see where you're at. There are definitely some supplements that your doctor can put you on. I would encourage folks to go to the doctor and get their recommendations, because there are a lot of supplements out there that say they're for this and that, but they may not be approved, or there might be some absorption issues. But there are some really important supplements that you should be taking as a senior that will really strengthen your bones. Weight bearing is walking around, standing up, light weightlifting, 1 or 2 pounds. working with some group exercises. Those kinds of things are huge with osteoporosis. And if you're not weight bearing, your bones are not increasing in density. That's how you maintain that density in strong bones. So those are huge.
Yeah, got my bone scan, first one, so it's going to be a good
Good.
the
Good for
future.
you.
Yeah,
Yes,
and so, it's just like, hey, if you didn't get one in your 40s or 50s, it doesn't matter. You can start
it
now.
doesn't. You're
Find out
right.
where
It's
you're
never
at.
too late.
It's never too late, 100%.
Mhm,
Okay,
mhm.
so great information here. If somebody feels like they've learned a thing or two in this conversation, which honestly, I know I have, and I'm around this quite frequently, what are some resources or a guide that you can send our viewers to help them take a deeper dive into this topic?
So I wrote it down because two of them are very similar. There are some really, I think it's important to find reliable
Yes.
guides that are well-founded and researched. One is the CDC, which is right here in Atlanta, and you can go to their website. They have a lot of really good information. My personal favorite, because I just feel like their information is so easy to navigate through and it covers a gamut of information. It's the National Institute on Aging, and it's www.nic.nih.gov. They have the initiatives that we are working on for seniors' health and wellness, which is so important for quality of life. We're no longer waiting to get sick or waiting to have that chronic disease. We are now in that mindset of wellness and holistic medicine, where we are treating all parts of our body, which is so important. And that is a focus on their site. Also, the National Council on Aging, which is also a government supported program. Those are all very good, reliable programs. I will say too, if you look up in your own community, there are local senior supported groups. Sometimes it's through the YMCA, it's through your health department. There are a lot of resources that most people don't realize are there that can help you provide some assistance, further information. If you wanted to join like a Silver Sneakers exercise group or something like that in your area, they will have all of that information for you.
Yeah, and a lot of that, especially for our seniors, low cost or free. So
Absolutely.
there's no reason to not get out there and see what's available in your community. Suzanne, this has been an awesome episode of Senior Living Live. Like I said, I learned a few things. I know our viewers will certainly have learned something new as well. At least we hope most of you did. Thank you so much for taking the time to be with us.
Thank you.
Now, if you enjoyed this episode of Senior Living Live with Suzanne, I really encourage you to head on over to our website. It's www.seniorlivinglive.com. There we have all kinds of videos, hours and hours of videos, just like this one, all about senior living on demand. And the best part, it is free. Thank you so much for being a part of Senior Living Live. Have a great day, everybody.